I'm Dr. Laura Ronan, and I'm a neurologist that teaches medical students at the Geisel School of Medicine at Dartmouth College. I discovered a unique approach called graphic medicine. About 4 or 5 years ago, I became acquainted with my colleagues at the Center for Cartoon Studies in White River Junction, Vermont. And together we developed a course using comics to teach medical students a variety of new skills that will help them with their training. So in 2017, we knew we were going to have the International Graphic Medicine Conference in Vermont, where I live. And so a group of cartoonists and I got together and we started teaching graphic medicine at Dartmouth Medical School to see what the experience would be like. And we eventually worked up a curriculum and presented our work, including some of our students' work, at the 2018 Graphic Medicine Conference in White River Junction. And since then, we've taught 3 or 4 years of this to medical students, but we also expanded what we were doing to medical residents that I taught and started using graphic medicine to teach about specific diseases and specific medical conditions in neurology, which is what my specialty is. We've learned that reading comics and discussing them as a group of trainees can increase doctors' awareness of how to communicate with patients, how to communicate with caregivers, how to understand what patients need to hear from their doctors and how they perceive the interactions with doctors. We've also picked up that students and residents are much more empathetic about their patients' conditions when they read these graphic novels, and they are able to approach their real patients in a more compassionate way after reading the what we call patient pathographies, or graphic novels written by patients that have these diseases. So what we found teaching graphic medicine and using texts in graphic novel format for our residents in particular is that comics are a really interesting pedagogical format that can build communication skills for doctors in training and appears to increase empathy and compassion during their training. That's really interesting because we know that as the training goes over several years, many of the trainees become less compassionate, and any modality that we can find that increases empathy is really valuable. For example, one of the exercises we do in our first class with our medical students is we ask them to draw a self-portrait of themselves as a medical student. And what does it look like? What are the accoutrements or the pieces of their uniform that make them a medical student, so that they can visualize themselves. Another great use of graphic medicine has been in developing materials to reach certain populations that are hard to message medical information to. Graphic medicine has seen an explosion in texts, and especially in certain fields like neurology, mental health, oncology, and end-of-life care, there are now really high-quality, beautiful texts that we can use to teach about these conditions, and our residents have shown that they can pick up subtle symptoms, subtle responses, subtle changes in coping and response to illness that really were not evident to them prior to reading some of these graphic novel texts.